Hello everyone. Today we'll study about a concept in general pharmacology called as enzyme induction and enzyme inhibition. Okay. Now, what is this enzyme induction means? If you look at the drug metabolism, the drugs will get metabolized by two group of enzymes called as microsomal enzymes and non-microsomal enzymes. Now, in this two enzymes, microsomal enzymes are inducible and inhibited. That means their number can be increased or their number can be decreased with drugs usage. Okay, that property is called as enzyme induction and enzyme inhibition. If you look at microsomal enzymes, we have various types of microsomal enzymes are present, of which cytochrome P450 is the most important microsomal enzyme which are inducible and inhibited. Now, when this microsomal enzyme inhibition and induction will happen means whenever the drugs are used for a regular period or after repeated usage of the drugs, then we can see either enzyme induction or inhibition depending upon the drug. Now, what happens if enzymes are increased or if enzymes are decreased means that leads to drug-drug interactions. Okay. Now, if a drug, for example, rifampicin is a enzyme inducer. Now, what it will do means it will increase the metabolism of other drugs. So, because of this enzyme inhibition and enzyme induction, there is a chance of drug-drug interactions. Okay. Now, let's learn about the drugs that causes enzyme induction and inhibition with a mnemonic. Now, first mnemonic is for enzyme induction, and what we have for the mnemonic of enzyme induction means it's CRAP GPS. It's a mnemonic, and each letter in the words represent a drug which has got enzyme inducing property. Now, first one is the carbamazepine. Carbamazepine is a drug which causes microsomal enzyme induction. Next one is rifampin and rifampicin. Both are the enzyme inducers. The next one is alcohol. There is a special property within the alcohol. Alcohol will cause enzyme induction as well as enzyme inhibition. Now, when it causes enzyme induction means whenever if alcohol is taken for a chronic period, at that time it causes enzyme induction. At acute phases or acute intake of alcohol causes enzyme inhibition. Now, after A, we have a word called as P. P for phenytoin, which is an anticonvulsant drug. It also causes enzyme induction. And G for griseofulvin, which causes enzyme induction. And P for phenobarbital, which is a sedative and hypnotic group of which comes under sedative and hypnotic groups, and barbiturate group of drugs, phenobarbital. And S for St. John's wort, which is a plant product, herbs, which is an obtained from the flowers, and it is used in the treatment of depression. Now, if we look at the mnemonic to remember the enzyme induction, we can remember the word called as CRAP GPS. CRAP means C for carbamazepine, R for rifampicin or rifampin, alcohol, phenytoin, and GPS means griseofulvin, phenobarbital, and St. John's wort. Now, coming to the next mnemonic, that is drugs which causes enzyme inhibition. Mnemonic for drugs that causes enzyme inhibition. And the mnemonic word is sickface.com. This is the word which is the mnemonic to remember the drugs which has got enzyme inhibition. Now, if you look at the drugs present in the sickphases.com, now first coming to the S for sodium valproate, which causes enzyme inhibition, and I for isoniazid, which causes enzyme inhibition, and C for cimetidine, which also causes enzyme inhibition, and K for ketoconazole, and A for alcohol, sorry, F for fluconazole, which also causes enzyme inhibition, and A for alcohol, which causes enzyme inhibition on acute use. and C for chloramphenicol, which is a broad spectrum antibiotic and it causes enzyme inhibition, and E for erythromycin and clarithromycin, which are also again a antibiotic group of drugs. Now, as for sulfonamides, sulfonamides are also antibiotics which causes enzyme inhibition. And coming to the COM, C for ciprofloxacin, and O for omeprazole, and M for metronidazole. And G for, it's a grape juice. Group G means group which represent grape juice. Grape juice also causes enzyme inhibition. If you look at this slide, in this slide, most of the drugs are antibiotics. Now, ketoconazole, antifungal agent, isoniazid, antitubercular agent, chloramphenicol, erythromycin, broad spectrum agent, sulfonamides, antibiotics, ciprofloxacin, fluoroquinolones, metronidazole is also a chemotherapeutic agent. So these are the drugs which causes enzyme inhibition. Okay.